Hi everyone, welcome to my channel and thank you for watching. So in this video I'm going to be talking about an overview of a full overview of what the Nmc Osce is. A lot of people have been asking, what is this Osce? I know some of you've just gotten your decision letter and you've been hearing that you're going to write the Osce exam when you get into the UK. So this video is going to give you a full overview of what you need to know about the Nmc Osce. The Osce exam is the full meaning of the Osce is the observed structural clinical examination. So this is the type of exam that is done where it's going to be timed, and it involves a silent station and a non-silent station. So in the Nmc Osce you have 6 stations, which includes 4 API stations, and you're going to be doing 2 clinical skills. In the Nmc Osce, the assessment phase, we have the assessments. The API includes the assessments, the planning, implementation, and evaluation. While the skills, you can come up with any skills. And most times, the assessment is always 15 minutes with a 5-minute period. The planning is 15 minutes, 1 minute period. The implementation is 15 minutes, and the evaluation also is 15 minutes. Then the skills, depending on the skills you have, there are different skills. Different skills comes with different time, and most times the skills also could be 8 minutes, 12 minutes, or 15 minutes. That's your skill 1, and your skill 2 can also be 8 minutes, 12 minutes, or 15 minutes. But most of the skills are always 15 minutes, though some can be 12 minutes. Now let's go back to the API. In your API you can have different scenarios, which could be a neuro scenario. First of all, API you can actually have tooth form either in a hospital setting or a community setting. Then also your scenarios in the hospital can be a patient with a neurological injury, which could be subarachnoid hemorrhage or a fall. That's the neurological condition you can have. Then it could be a pre-op patient or a post-op patient. Then you could have patient with shortness of breath or COPD, and you can have patient with chest pain or myocardial infection. That is the cardiovascular patient you can have. Then you can have a patient with depression. That's majorly come up in a community scenario. And also community, also you can have a MUST. That's MUST is the malnutrition, is a skill that is to check for if a patient is malnourished. Now in the skills, there are different types of skills. I think presently we have I think 10 skills. Yeah, so you should be able to do all the skills. When practicing or when learning, you should practice all the skills, because you don't know what Nmc is going to give you on your Osce day. So we have IM injection, subcutaneous injection, peak flow, self-retaining catheter removal, and self-retaining catheter care or catheter specimen urine. You can also do BLS, that's basic life support. Then the ANTT, which is majorly aseptic non-touch technique, and it's always a wound dressing. And also inhaled medication, you can have an inhaled medication procedure where you have to administer an inhaled medication. Then you can also do urinalysis or midstream urine, and fluid balance. The fluid balance chart is one of the recently added skills, and you have to be very careful when if you have a fluid balance chart. Calculation is one of the things that makes people fail there. If you miss any figure, so you have to be very patient when doing a fluid balance chart. Okay, now about the Osce examination. Presently is done in 3 places in the United Kingdom, which is Ulster, University of Northampton, and in Oxford. So if you want to register for your Osce, you have to contact Nmc. You have to contact the university. They're going to send you a link for you to register for the Nmc Osce. Now the Nmc Osce, you have mostly you have 3 attempts to write the exam. You have the first attempt. If you fail one of the attempts, now you're just going to do one skill again. You're just going to do the skill, the part you failed. You're not going to rewrite everything. You're just going to write the part you failed. That's what NMC does now. And most times you have 10 working days to wait before you can rewrite it. And if you failed it second time, you have another 10 working days again before you can rewrite it the third time. So, and if you fail in 3 attempts, your portal will close and you have to reapply again. And presently now, the second attempt, you just pay half, which is about £398 for the examination. So if you've learned one thing or two things about this, I'm sure you've picked something about the API stage and the skills, just for you to have a rough idea of what the Nmc Osce is. Now you can watch my other videos about the API. I've explained what the API is. I'm going to keep on doing this video, and I'm going to start doing some skills. And if you have any question, you can kindly contact me. Send a message to me on my Instagram handle, which is exclusivity. You can send me a message on my Facebook, and I will be ready to answer all your questions. You can also leave a comment on this video. Thank you for watching, and guess what, I'm going to be seeing you in my next video. Watch out for the news charts. Thank you.